Welcome, everybody. My name is Nick Constantine. I've been doing search and rescue work for about 10 years, and I'm currently on Seattle Mountain Rescue. I've got the pleasure of speaking with Laura McGladrey today. She's a psychiatric mental health nurse practitioner, mountain rescuer, volunteer ski patroller. She works in the emergency department at the University of Colorado in the Stress, Trauma, Adversity Research and Treatment Clinic. She also has an organization called Responder Alliance. She's a NOLS instructor. She's also done podcasts with the American Alpine Club, Disaster Podcast, and Responder Strong. Welcome, Laura.
Thanks. It's great to be here.
Well, what we'd like to talk about today is psychological first aid, specifically for mountain rescuers and first responders in the search and rescue community. So I appreciate you taking the time to talk to us and go through a little bit of that.
Sure. Yeah, I'm glad to be here.
Fantastic. So I think from a standpoint of stress injuries, I'm hoping that you can just give us kind of a basic definition, talk a little bit about what stress is, what it means to have a stress injury, just kind of give us a broad overview.
Sure. So there's a lot of conversation, I think, about stress, and stress categorically just means basically that the pipes are too small for whatever you're trying to put through them, and the system comes under stress. There's a lot of overlap with stress and traumatic stress, and that's really my area. And that's coming to the forefront of sort of an understanding of a new, I wouldn't call it at all a new injury type. I would say we're really starting to see patterns that are consistent with what we call injuries. And traditionally, we've called that post-traumatic stress disorder. I think that's a term everyone's familiar with. But it doesn't necessarily capture all of what's happening. And especially when we start, my background is with first responders, emergency responders. So I work with law enforcement and fire and EMS. And as you mentioned, I'm in the emergency department myself. And so we see in that population, that's a group that's been studied now for some time to know that the stress and exposure of the workplace has an impact on people's lives. But the only way I would say that I really interface with that in what I'd say is my day job is when people get to a point where the impact of all that stress and exposure makes it hard to function. And at that intersection, we start calling it post-traumatic stress disorder. And the reason why would it be a disorder really relates to the fact that you're not able to live the life that you love in the way that you love it. So there has been a conversation thread for quite some time. Actually, it did start at the military and has been now circulating in emergency responders. And thankfully, in the last few years, again, you mentioned I'm a NOLS instructor as well. It's been our curriculum at NOLS and some of the larger wilderness medicine education providers to start recognizing, hey, there's an injury type that we're not preparing people for in the remote context, and that's these stress injuries. So there's a real distinction truly between, PTSD is a type of stress injury, but it's a late changing type, meaning it's when things have made it really hard to do your life well, as I mentioned. But there's a more subtle type that I actually see impacting the wilderness responders that I work with in mountain rescue and search and rescue and ski patrol, et cetera, which is this sort of earlier changes, and we can talk about that. So the national conversation is really moving away from just saying that person has PTSD, and there's sort of a broader conversation about stress injuries now in the wilderness responder.
Yeah, and one thing, I remember Rich Gerling saying this a couple of weeks ago when we were talking, and he said, it's not about, having wellness or being well. It's about broad human performance and about actually functioning as an individual at your peak performance level. And I think that goes along with being on a team as well when you're with a search and rescue organization, and having the team also be able to perform in stressful situations and with missions that are obviously fairly critical to do at peak performance.
Right. I mean, I think this gets left out of the conversation sometimes, and Rich and I have joked in the past about this. I mean, organizations who push for performance don't really care a lot about your happiness. They really want to make sure that their assets are being used, like the military. And I think that's not our situation in Mountain Rescue. But we're in the same boat in a sense that the research now that we lean on says that when we're impacted by stress and by trauma, the world gets more narrow for us. And we can't do the jobs that we used to do well because so much is clouding the lens that we're looking through. And so that's a real area of interest for me, that the folks who've been in this long enough to be impacted by the scenes that they've seen, the rescues that stay with you, the things that don't leave you, are working through a lot of data every time they show up on a mission and on a scene. And so that's kind of at the heart of what we want to sort of unpack and support. Because each one of those exposure types, as we know now about trauma formation, needs to be cared for in real time and taken care of. So.
Well, let's talk a little bit more about stress. You mentioned a little bit about the varieties of stress, but maybe talk a little bit about kind of the good stress that we might have in our lives, and then maybe we can start to err towards talking about stress and stress injuries, and talk a little bit more about that.
Right. I mean, I think we all probably have some, everyone listening has some experience or interface with the thing they like to push the edge. That just tends to be our people, right? We like to push the edges on things, and there's a reason for that. So when we get under a state of, I hope this works out, I'm going to ski this line, or I'm going to climb this thing, it's probably going to be fine, but I'm right up at my edge. We do know that there's a place for peak performance there, and that's, you release dopamine, it makes you alert, it makes you ready, but, or I should say, and there is a point where you push that too far and you sort of move past the point where you can learn and innovate and enjoy, and you're basically into survival. And that's sort of the line of stress that we want to keep an eye on.
Yeah, so I think commonly what I think of is when I take on too much stress. But I've heard you talk a lot about in the past about stress injuries and the formation for those, and the triggers that can be present that then kind of put us in a state of heightened awareness, heightened arousal, to where we can't actually turn that back off.
Mm-hmm. Right. Right. We're designed for that, but we're also designed the way that our brains were built for survival. And so if we get in situations that the brain codes as more than we can handle, so a definition of trauma that I really like is the stimulus that overwhelms one's capacity to integrate it. It could be anything. It just means, and that might be on a rescue where things were going fine until the slope changed or the weather changed or a patient's condition turned or something. And all of a sudden a responder finds himself, or a rescuer, in a situation where they're like, I didn't plan for this, I'm overwhelmed. Or sees something happen to someone else, perhaps a climbing fall or an injury. That's where the brain's actually in a code that is happening to you, and it's too much to handle. And when that happens, you kind of miss this really important survival mechanism, which is the all clear signal that gets us back to a place where hormonally and physically our bodies can come down from the mission and say, that was crazy, but it's over. And when we have those types of missions where we can't come back down, then our bodies have to keep responding as if the threat is still there. That's hyperarousal. And it turns out there's a hormone connection to that our bodies have to respond to, which is why those stress injuries are not just psychological injuries, but they're physical injuries as well.
Yeah, I'm glad you mentioned that. I was actually going to bring it up. I know we'll talk a little bit more about the stress continuum here in a few minutes, and where kind of PTSD fits onto that. But talk a little bit more about the physical injury part. I know that, as we do formulate stress injuries, there's a variety of things that can happen to us, physical being one of them. And maybe just kind of highlight that a little bit more.
Sure. I mean, I think that as both a family and a psychiatric nurse practitioner, I spent the first part of my life, again, in emergency medicine, taking care of people's bodies. when I went into mental health as a focus, because in trauma as a focus, I was really surprised that it was all of a sudden all about the brain and how your brain's doing and are you depressed or are you anxious. But when I would do labs on the firefighters and law enforcement that I worked with, I would find physical evidence that their bodies were sustaining stress over time. So the way that plays out is that our bodies respond to and survive with chemical mediators. And that comes from our survival brain, the limbic system, right? So when we see a short-term threat, we'll send out a signal, the catecholamines, that get fight or flight going right there in that moment. We don't even have to think about it. It just happens. When there's a longer arch of a threat over the mission that you don't come down from and the arousal keeps going, then we secrete this thing called cortisol. And what's probably most accessible for us, if we've ever had any interaction with anyone that's taken prednisone is like an outside version of the inside hormone that we take. So this is a pill that's really good if you're having an asthma attack or anaphylaxis or something to suppress your immune system and make it stop. But if you take it over long term, just like if you secrete it for yourself, we start to see fat deposits, central adiposity, weight gain. And from that weight gain comes inflammatory mediators that cause heart disease and diabetes. We see pathological fractures. We see people's skin changes, actually. And some of this changes, everyone just writes off maybe as getting older, et cetera. But, I've worked with rescuers who are very young, 30s and 40s, who are having pathological fractures in their back machines. There's no good reason for them. And they're having diabetes when they're otherwise active, healthy people, and heart disease, cancer, et cetera. So what gets missed a lot is that when we sustain stress over the arc of our lives, there's a tremendous physical toll for us. And what the thing that really gets to me about this in the wilderness responders and search and rescue is that we need our bodies to function really well to keep doing what we do well. So we need to be addressing this early on, and we need to be thinking about if you come home from that mission and the mission isn't over for days and days and days, your body is still paying the price for that and bearing the weight of that in a physical sense. So you can't really get away with saying, hey, mentally I feel fine, this isn't affecting me, because your body tells the story. And I see that time and time again with people. And I think most of us can relate to that really busy week of work, or maybe we all did that thing where we got to the last week of our finals and came home in college and got, and crashed for days and got really sick because our bodies just crashed. That's what we're trying to pay attention to. That's also a part of stress injury formation.
Yeah, and I think as search and rescuers, mountain rescuers, ski patrollers as well, we get in this cycle of having to go back out again, right? Because we don't know when, especially in the search and rescue realm, we don't know when the next call will come.
That's
right. It might
right.
be a week, it might be a day. And I think, when you're doing something more first responding in an urban environment, it's probably a lot more often. And obviously in the ski patrol world, it might be more frequent as well. So I think as we have these stress injuries, as we're already in a heightened state of stress, do you mind talking a little bit about that and what's the likelihood of reoccurrence, especially when you're in a heightened state already?
Sure. Right. So that is probably one of our greatest take-home messages when we start thinking about, well, what are we going to do about this, right? It would be unfair for me to come and say, well, and this is your story. If you're in mountain rescue, you're probably going to have a lot of stress and you're going to end up with this injury type. I mean, the good news is that once you start recognizing what's going on and the impact of exposure, you can just start mitigating it and caring for it in real time. And probably one of the most profound ways that we do that is just shining a flashlight on the fact that when we're under stress, and we'll look at this a little bit with the stress continuum, when we're in a state of stress, we're more likely to interpret the world as a scary place, to feel like we don't have resources to handle what's coming up in front of us, that everything's a problem and there's no real room for complexity. So our brains code it as much more stressful than it actually is. And so it's an important adage as we look, try and get self-contact with how the stress is impacting us. if we find, wow, I'm really stress impacted here, making that next decision when the next, however you get toned out, your pager goes off, your cell phone, etc., and somebody needs you, but you know you're in a state of stress, you're more likely on that call or that mission to get injured than those who are coming at this from a resource place, who have room for what's happening and are not interpreting the world in that way. And so this is a really tricky thing. I work with several rescues that have more than 200 missions a year. That means if you don't go out, or if you have a specialty, your dog handler, your snow science, or something that in your medical, your team needs you, you're going to be compelled to go out despite what your body's telling you, despite the fact that you know you're a little bit over the red line, because there's also this team dynamic. And I think that's where, as teams and as rescuers, we can start to shine a flashlight on that, and basically to say, hey, and this is why that's how we use the continuum, to say, hey, if you're in a state of stress, maybe you're in the orange, we'll talk about that. This might not be your day, because we know you could get hurt. It would be very similar to a patroller who has a knee injury that's really bothering them, and they get called out to some double black, you got to pull the toboggan. Everybody knows that's not going to go very well. We need to kind of change our culture so we can say, hey, we know about your knee. We'll send somebody else. Why don't you go ice it? We're cool.
Before we talk about the stress continuum, let's chat a little bit about how the brain processes things. I think, one of the questions I had early on when I was listening to the podcast and then some of your other work was, and you did explain this quite well, but how the brain actually functions to process in triggers when we do have a heightened state of arousal, when we do perceive danger or stress, a near miss on a mission, or something that's just, traumatic that we witness. How does the brain process that? How does it function?
Well, that's a complex question. Let me see if I can get to that easily. I think, sort of in broad terms, we can think about these couple parts of the brain that are always kind of going back and forth. The part of the brain that we think about being the brain that I'm using right now to talk to you. If you're a neurobiologist, forgive me right now for my oversimplification, but the part of the brain we can access usually is the cortex, right? That's where executive functioning happens, decision-making, creativity, language. And that's what's normally driving and running the show. And that's how it should be. But we also have this amazing part of our brain called the limbic system, and these pathways that, oversimplified, of course, but they're our survival mechanism. And so that part of the brain has been intricately designed to jump into action in a second's notice and override the cortex, because survival's on the line. So you think about these two parts of the brain driving in a car together. On a regular sunny day going on a picnic, the cortex gets to drive. But the minute you hit adverse conditions, or the road gets bad, or there's a threat, the limbic system jumps in the front seat and drives. So when the limbic system takes over, let's use an example that I like to use because it probably won't affect us here today. But let's say I was walking on just a hike in the woods, and I heard a noise behind me. I'm in Alaska in early season, and I look behind me and I double take, and I see what I think is a grizzly, maybe 100 yards back, and feet, probably, let's say not very far. I don't care how far. And I look back and I think, my brain, before the cortex even does anything, limbic system jumps into action for survival. And I am running before I know I am running. And my heart is pounding and my body's preparing for action. And that is what we want to have happen for us to survive. Now, let's say I run a bit, I'm panting, I look back to see how far away that grizzly is, and I look again, and it's not a grizzly at all, it's a sheep. And I'm like, okay, what? I'm confused. And I look again, because I think I'm surviving, right? And I look back, sure enough, 4 legs, furry, white, sheep. And I'm like, what the heck is going on here? And so probably what happened was my brain was already thinking about the dangers around me. I did this amazing, very quick coding system, 4 legs, furry, it's probably a bear, and my body responded. Now, in that moment, when I look back and I see that it's not a grizzly and that my life is not threatened in this moment, this amazing thing happens. I send out the all clear signal and I release hormones that say, basically, you survived, that's over. That could happen 100 times in my life. I would never remember it. But the one time that I look back, I hear a noise, I look back, it's a grizzly, I start running, I run a ways, I look back again, it's still a grizzly, but now it's chasing me. And let's say I climb up on a rock, I try and get away, I barely escape that. In that moment where I feel overwhelmed and I feel terrified, and I feel that I'm helpless to get myself out of this, my brain will not fire off that all clear signal. It will just keep looking for survival. So even if I survive that moment, come down from that, go home for days, my body's going to remember in a very pristine way all the details. There's a failure of the all clear signal. So all that to say, when we talk about hyperarousal and after a mission where it looked like someone you know or love, or was the exact same thing. I work with some rescues where these are climbers who are responding to other climbers on the same wall they plan to climb on tomorrow. When that happens, your brain sometimes codes this as overwhelming. Could be me, this is happening too, or I can't get out of it. You don't ever fire off the all clear signal. And that's how stress injuries could get formed on rescue.
Yeah, that's quite powerful. I think the key takeaway for me there is that you talk about it could happen to us. The concept that when we're out there, we're trying to help. It's also very clear in our head that this is somebody from our community. This is somebody who we're trying to help, and then that inherently triggers the brain without us even knowing that it's happening. It's in an area where we've been before. It's maybe somebody we even know, or it's somebody that we know that somebody knows, or there's just so many ways that our brain, can consciously connect that, but then what's going on under the surface is completely out of our control.
That's right. And that connection is not unusual if you do search and rescue in a small community. Or a mountain community, or particularly there's a few rescues that I work with who have to respond to aviation crashes, or, they're sort of everything on that team. They are intimately involved. That accumulates over time. And so there might be some protection, I guess, if you're in a bigger city as you are, et cetera. But what I also hear from rescuers a lot is especially if they're highly publicized rescues, you'll find you won't know them. Maybe you'll carry this body out. It's a recovery, but you'll still watch the news that night, which is their Facebook feed and their family and the connection. And so that can be really impactful and needs to be cared for. Yeah,
that makes sense. Well, let's talk a little bit about the stress continuum now. I think we've got a foundation of understanding what stress is, what the triggers are to some degree, and how our brain processes that. But let's kind of get a little bit into the academic side. And if you don't mind giving us a little bit of a background on where the model came from, and then how it's being adapted into different facets of the rescue community, first responder community, et cetera.
Sure. I actually encountered this continuum about a year or maybe a year and a half ago. I was working with a friend who is a battalion surgeon and shared with me how they were using the stress continuum, or how he had used it in combat. Since that time, or over time, what was first designed in the military has now been calibrated for structural fire, law enforcement, wildland fire. We certainly use it in the national parks and rescue now, and in ski patrol we also use it. And the idea really is just an objective, and it's only objective to the person doing it. This is an important point about this continuum, that everybody has a different stress point, and everyone's going to respond to stress in a different way. But the heart of what this gets at, which I think is really helpful, the continuum, is that there are early and late changing signs of stress. We tend to be a group of folks as rescuers who put others people's needs before ours. We tend to rescue. We don't tend to do a lot of talking about our emotions. And so someone has to be in significant amount of pain to have that externally demonstrated, right? And then we might say they have PTSD. One of the goals, I think, of the use of this stress continuum is to identify earlier on that subtle changes are happening as they relate to stress and can be cared for earlier before these later changing reactions, which, by the way, are very difficult. There can be sometimes to mitigate. They just take more work, just like any other physical injury. So the way the continuum works actually is pretty simple. It's a green, yellow, orange, red continuum. And it would, green would be basically spiritually, emotionally, physically ready and good to go. Yellow would represent a stress reaction. So that might represent a change in someone's motivation or desire to be out there, or engagement or concentration. I can come back to that. The orange would be more representative of an actual injury, so that really starts to be very impactful on people's lives. So that sleep is disrupted, relationships are disrupted. It's impacting not just your mountain rescue or your search and rescue life, but also your relationships. It's interfering with your ability, let's say, to concentrate at work, or to enjoy things, or to do the things that you used to love to do. So in orange, we see a lot of people with the I used to kind of syndrome, meaning like I used to love going out with my rescue after missions. I used to come for rigging sessions on training. I used to love to help train the new trainees, and now I don't. There's a lot of lost what you used to do. And a lot of things at this point are a problem. People are annoying, your recruits are annoying, their ideas are annoying. This mission, I don't know if I can say this on the air, was bullshit. Why did we get called out to this? This was not even what's wrong with people. Everybody, why can't people take responsibility? Just a lot of that sort of crankiness, irritability, where people be like, gosh, this isn't really me. And then finally, the red, I think, would be more recognizable to us as something like we associate with PTSD, which would be significant sleep disruption, anxiety, depression, lack of function, substance use, and disintegrating relationships and connections.
Yeah, and I think, you called out a couple of times that, PTSD is a very specific place along the continuum. And I think, at least for myself, I think that was a big misconception. And I think, our society has been using the word PTSD for quite some time. We're trying to shift away from that. But I think we have this concept that PTSD is anything where you've, been susceptible to a stress injury that's perpetuating, or that's kind of sticking around for a bit, when in fact it's probably further along on the spectrum. And I think the other takeaway I have from this is, to me, it doesn't seem like it's a checklist, right? Like, I think some people might operate where some of these factors would be impacting them, but it's not that you have to have all of these to be like in the orange or in the yellow. These are just indicators that, if you have some of these, and some of them, I think from what I've heard you say before, is people may not have them at all in that capacity. They, in fact, might have a slightly different way that they're coping with it. So I think for me, at least, I kind of take these as indications of, could somebody be in that specific category?
Absolutely. And I think, to be fair about PTSD, if anyone's listening and they've ever been diagnosed with this, or they know someone, like, PTSD is a very significant and still remaining. It's diagnostic of something. But I think what's unfair about the nomenclature they've chosen to use, I just described to you why it's the most adaptive mechanism of our lives, and it's why we've survived for millennia. So to say you're disordered when after that traumatic exposure, you're in a state of hyper alert, your life no longer, your whole job is now survival. So you can't focus on your job, and you can't focus on your relationships, and you can't focus on learning the knots, for your team, because you're surviving. I'm not sure disorder is the word we want to use for that. And that's why I actually prefer stress injuries. And I think with that, part two of why stress injuries are so important, this is actually an occupational exposure type. I think sometimes it's treated like a moral failure, or it can be treated like something that happened to you. You know, it's like, no, you had exposure in your job, just like if you had smoke inhalation as a firefighter. This is occupational exposure, and it actually plays out in a very predictable way. So for these high exposure jobs, and roles, and this is the unpaid professional mountain rescue too, to have exposure after exposure after exposure in your career and to have it not affect you would be extremely unusual. So we have to flip the paradigm, because right now we say, oh, isn't that what happened to that person? You know, 1 in 100 people have this happen, and it's just, that's because we're only looking for the red, sort of the PTSD. If we actually looked for how many people were impacted by being rescuers, and we started with the yellow, that first time you noticed the change, that you were like, man, I can't believe I get to go out on these calls. I can't believe I get to do this. The first time you get paged out and you're like, I don't want to do this. That's
makes
that's
sense.
Yeah, that's early change.
And I think, where do you think most people, tend to operate along the continuum? I've heard from some of the discussions we've had before that it's, green is sort of a state of an ideal state, that it'd be, uncommon for somebody to be fully in the green all the time. They'd probably be, I think maybe you even said, kind of more like a Yoda at that point. So, while we might strive to be in the green, and while we might be able to be in the green for some amount of time, my guess is most people don't probably operate in the green on a daily basis.
Right. Well, candidly, we don't. This is very true. We can't quite study this because we don't count anything until you're going up in flames, basically, as impactful for your job. So we have to kind of change the conversation so that we can get talking about people's actual experiences. And I think this really conversation goes a long ways to do that, where people can say, yeah, I'm absolutely impacted by what I see. I'm definitely not the same person I was before I started doing search and rescue. And here are some ways where that happens. And some of it I love, and some of it I wish I could resource more. I'd like to put some more oxygen in the room, because there's parts of me that I'm not sure I want to leave like this, if they're irritable, or I'm isolating, or I don't go ski on my off time anymore because it feels different than it used to.
And how do you think, I'm imagining the further along the spectrum you kind of move, the harder it is for you to maybe even have a perception of where you are on that spectrum. Would you agree with that, or do you think that's a bit of a misstatement?
No, I think it's really insightful. I think that's kind of gets back to stress injuries occur in the state of stress. So when I talk about this continuum with law enforcement, in particular, or fire, often people feel it's terrible to feel like you're in the red and you identify yourself there. And maybe someone listening actually feels this way. The feeling of being in the red is, I don't have any choices. I'm stuck. There's nothing else I can do. And it'd be great to do more, whatever, meditation. It would be great to exercise or get connection, but I can't. Everything I have is going into doing what I'm doing right now. Now, imagine what we started with in the beginning. How do you get stuck in a volunteer position? Here's how you get stuck. The people you care about are depending on you because you have a skill that nobody else has, or you get called out on missions and there's not enough people, or you have to go, or it's an identity thing for you. You can't stop it, but you don't want to keep doing it. That's stuck. So from there, it gets really tricky when you're in the red to just, pull yourself up by your bootstraps. But the problem is, the more you persist in the red, remember, you're more likely you are to get hurt by the images and exposure that you see.
Yeah, and I think you bring up a good point, which is when the call does come in, and your pager or your phone goes off, or however the alert comes at you, you've got this feeling of being compelled to go out because somebody's out there waiting and needs help, and your team is in some ways waiting and needs your help as well. And I think we get in this trap, especially in the search and rescue community, of feeling compelled to go out and assist. And
Yes.
We maybe haven't moved ourselves fully down the spectrum enough. And now we're kind of, causing our heightened state of arousal to be even more triggered. So I think that's a pretty powerful message for a lot of folks that do search and rescue work as unpaid professionals, that we kind of use the term for now, just because you could be at work, it could be 2 a.m, and something happens and you get the call and you feel like you need to go and help because, to be honest, nobody else is going to.
Right. Right. And that's the same. And this plays out for us in a lot of ways, but let's put that into physical injury category. Your back is hurting, that you've slipped a disc, but there's no one else to carry the litter with you. I mean, there's only 4 of you. You're going to do it. That's rescuers. That is, I meet very few rescuers who wouldn't still step up to the plate. So what all I'm trying to do really is to bring this conversation and awareness, that if you're in that state of stress, if you're listening and you're going, okay, that's me, or maybe you're like, that's so-and-so on our team, maybe they're not a jerk after all, maybe they're actually stress injured. That person, to keep going out and over doing it just would be like a back injury. There will be a predictable end to that. Eventually you'll herniate your disc and it's going to be nearly impossible to keep doing this work.
To be fair, I didn't know I had a back injury when I was going on some of the missions. I later found out I did have a herniated disc, so that was
I wasn't meaning to talk to you.
Explanation of that. Yep.
Yes. Okay. Fair.
Yeah. This is I think the stress continuum is quite powerful, and I think it's a tool that we're going to see a lot more search and rescue teams starting to use. I know on my team, I'm hoping to kind of bring that back, evangelize it when new members come on board, use it as for individuals to kind of help gauge a sense of where they're at, for the team as well to kind of from a peer-to-peer perspective also gauge where other people are at, and then in the big picture try to understand where the team itself is at. Are there a lot of organizations that are using this at multiple levels like that, or do you kind of see most groups just using it purely from a standpoint of an individual usage case?
No, I think it's powerful to look at this continuum also from a team standpoint. I certainly work with wilderness organizations like Outward Bound I can say Outward Bound USA and Canada have incorporated this. And, I think YOSAR, what we're doing this year is using the continuum, not just to talk about how is the individual doing, but think about this. If we can sort of move this metaphor further, if you're team is red, meaning you are a somewhat, green person who comes onto a team, you have new ideas, you're excited about it, and the leadership is like, we don't have time for that, there's not enough money for that, that's not going to work, we already tried it. You see calcified perspectives, you see silos and sort of cliques of people, and there's not a lot of connection. It's not going to take very long for that new trainee to be like, okay, is this how I'm supposed to operate? Sort of dark humor and talking about, whoever you just responded to behind their back, whatever it is, teams can actually operate in the red too. And what's impactful to me is that team members are more likely to get hurt on those teams, because at the heart of I guess you could say the opposite of stress injuries occurring in a state of stress is that when you or your team is operating, if you will, in the green, which means you're resourced, there's room for complexity. There's rich connections on your team. We talk so much about bringing someone in to debrief a critical incident, but really at the heart of that, and we'll talk about that with psychological first aid, is if the team is connected already, if there's enough room to manage how complex that was. The deal with trauma, at the heart of it, it's not simple. It just needs to be integrated in real time so it doesn't accumulate, so that there's enough safety and enough space on a team and enough connection to get to say to each other, man, I can't get that out of my head, or that was really hard. How was your experience? Yeah, I'm still thinking about it too. How are you sleeping? Yeah, whatever that might be. And so absolutely, I would say the majority of the work that I do is really more around how do we resource the team to be connected and open and recognize these injuries early on. That's, I think, really where the money is, because the individuals will then, as rescue teams do, want to be part of that culture. If we know that performance and excellence and best practice is caring for traumatic exposure real time and being resourced and basically pre-incident resourcing, like pre-oxygenating before the stress we know will happen happens, that's where the money is.
Yeah, you mentioned caring for psychological first aid in real time. Let's talk a little bit about psychological first aid. Maybe give us a bit of a definition for what you kind of view that to be, and then some of the, I don't know, skills or tools that kind of come along with that.
Sure. So psychological first aid, that term has been around for 50 years probably. Where we're seeing it used now, in the mid early 2000s, we saw sort of a collective of the world's experts come together and say, hey, what do we know absolutely can we hang our hat on helps people mitigate and integrate trauma in real time? Basically, what's that early intervention so that we can prevent stress injuries and PTSD from happening? And I think we can relate to everyone in a different way. Let's say you are involved in avalanche rescue and you come on scene and your rescue turns into recovery on scene. You're sitting with or watching or responding to the party who is skiing with them, might be married to them, might be related to them, might be, just met them, who knows, but they're clearly impacted by what just happened to them, and they have no physical injuries. And so psychological first aid is really the toolkit that goes with the injury type. So, right, in wilderness medicine, it would be, let's say you have a chest injury, the toolkit would be like assess for a pneumothorax or a hole in their chest and make sure you cover it, and et cetera, right? We can think about broken bones, we would splint it, et cetera. Psychological first aid are the interventions we do in real time to help people when we suspect that they have been overwhelmed or helpless or have sustained a stress injury, to try and mitigate that so that it doesn't go on to be a debilitating injury for them. And that's impactful because we need to know there are actually evidence-guided tools that are reproducible, that with some effort, we actually can help people, and this is the heart of it, at the moment that they're impacted, for that person on the side of a mountain, to help fire that all clear signal so their brain realizes that was so overwhelming, but I made it out. I survived. The slope isn't sliding anymore. That's not happening anymore. So I can stand my arousal right now. And so that's at the heart of it.
I think that's about all the time we have for this discussion right now, but let's pick it up next time with an overview of some usable principles for our rescuers.
Thanks for having me.